Welcome to Inside WRHN. We have another update on the amazing work that's happening at the Waterloo Regional Health Network today. And I'm Doug Earle. I'm the CEO of the WRHN Foundation. And joining me today is our co-lead for ophthalmology, Dr. Toby Chan. So welcome. Thank you for joining us.
Thanks for having me, Doug.
Great. So to start, maybe you could just share a little bit about your role at WRHN and our ophthalmology, or as they talk about it, as the Regional Eye Program.
My name is Toby Chan. I'm a glaucoma surgeon here in Kitchener-Waterloo, and I'm co-division lead for ophthalmology together with my colleague, Dr. Krisa McAllister. We are a regional center for eye care surgically in the region, and we cover call for Kitchener, Waterloo, Cambridge, and Guelph, and all the surrounding smaller communities in terms of providing acute and chronic eye disease management.
Oh, tremendous. So can you tell us a little bit about the eye care services that are offered at WRHN?
Yeah, so it's tremendously grown over the years. When I first started here about 12 years ago, primarily the surgical service that we cover is cataracts. And since then, we've grown into covering cornea transplants, oculoplastics, and orbital surgery. I became the first fellowship-trained glaucoma surgeon here in the region. And then after me, there was another cornea specialist that was hired. We also have Dr. McAllister, who's my co-lead doing pediatric ophthalmology and strabismus surgery. And recently, we just hired our new retina surgeon and our new cornea surgeon. So it's grown a lot over the years in terms of subspecialty coverage for eyes.
And with cataracts, of course, the wait times were always an issue. And what innovations has the program done to help with your caseload, your wait times?
Yeah, so being in what the Waterloo region was known as the Silicon Valley of the North, I think we have the local advantage to get to work with a lot of tech startups and particularly with the eHealth Center of Excellence. Back then it was the name, and now it's called Amplify Care. And together we launched with Ontario Health funding the centralized e-referral system for cataract surgery. It's basically an idea that we kind of took, kind of stole from orthopedics, because they've been doing it for hips and joints replacements, and that's really helped us optimize our wait list for the patients here. And the wait time has gone all the way from over 2 years to just a few months to get cataract surgeries here. So it's huge for patients.
Mm-hmm. That's tremendous. A little bit of innovation, and people can get their eye care much faster.
Yes.
It's amazing. I was wondering also, the growing aging population that we have, and some estimates 20% of the population may have an eye disease. Can you talk a little bit about some of the complications and what it means as our population ages for eye care?
Right now, as we know, the population has grown a lot in the region, first of all, and that comes with also a bigger subgroup that is aging, and life expectancy has been longer, and the technology we have for eye diagnostics is also better. So a lot of eye diseases, especially the chronic ones, are getting detected earlier at younger ages, which means intervention have to be done earlier, and at the same time, chronic follow-up have to be longer. So as a result, the demand for subspecialty care in the region is higher for specialists to cover all these chronic eye diseases. So I think as we can see locally, both on call and in clinics, the demand and the volume have grown a lot in terms of the number of patients that we have to see, and also the complexities of the pathologies we have to cover.
I know a number of people, of course, who are living with diabetes. Mm-hmm. Is there a specific concern for someone living with diabetes and their eye health?
Yeah, a lot of times actually diabetes can be actually diagnosed firsthand through an eye exam. Because the eye is filled with tiny, small blood vessels, and a lot of the early diabetics, the pathology actually show up in the small blood vessels in the back of the eye. So not just for early screening for diabetes, but also as the disease progresses, they can cause loss of central vision from macular edema. They can have sudden loss of vision if they develop vitreous hemorrhage from new blood vessels growing as a result of diabetic retinopathy. So the impact to quality of life can be both acute, sudden, and also long-term for patients with diabetes.
So a message for someone living with diabetes is to get a regular eye exam. So if they do have the diabetic retinopathy progressing, that they come and see the service at RHN.
Yes.
With the new treatments we have, of course, and it's caught early enough, I understand that they can actually repair the damage and go off the medication. Is that the case? And
Yeah. With early intervention, you can probably definitely prevent the disease from progressing into more advanced stages where more advanced or more invasive interventions are required.
And also with age-related macular degeneration, which is a growing disease of aging, is there treatments available for people to help maybe delay or change the progression of the disease?
Yeah, so for macular degeneration in general, there are two categories, the dry type or what we call the wet type, which involves bleeding blood vessels that are abnormal in the back of the macula. So for dry type, over time, what we usually support is eye protection from UV light, vitamin supplements, for instance, but there's no in the market kind of medication that we can use to treat in terms of injections at the moment. But a lot of research is being dedicated to that type of pathology right now, and they are up and coming down the pipeline. For wet macular degeneration, patients often require monthly, if not bi-monthly, type of injections into their eyes. And that can, if done early, halt the progression of the disease.
And on the glaucoma front, of course, that's your specialty.
Yes.
Is there been advances in treatment that are out there, but also offered at RHN?
I'm fortunate enough to be one of the glaucoma surgeons in the region that allows what is called microinvasive glaucoma surgery to be performed on site. And trabeculectomy is the traditional glaucoma surgery, and it involves a lot of cutting of the eye, and the procedure is longer, require more stitches, and patients take longer to recover. But taking the idea from microinvasive surgery, we are able to achieve the same kind of pressure reduction for the eyes using microstents and microshunts. And the recovery time for patients are a lot faster. And the surgery time itself, in terms of duration, is also a lot shorter. So a lot of more favorable outcomes and quality of life after surgery for patients here.
Tremendous. So I'd like to just spend a couple of moments talking about the retina service that's offered. Of course, it was a donor and philanthropy that's played a big role in establishment of the program in September of 2023. So has there been any further developments? So what has philanthropy been able to bring to Waterloo Wellington?
Yeah, so I would like to first of all thank the donor support that allows the retina surgery program to be launched in the first place. Because with retina surgery program in most regions in the province, the biggest challenge is to have the capital funding to launch the program first of all. And then beyond that is the ongoing operational funding support. And without the capital support from the get-go, we wouldn't even be able to start the program in the first place. So tremendous support from the Savas Chamberlain Foundation and from the RHN Foundation, we're able to have the hardware that's required to allow retina surgery to be done locally. And since then, the amount of retina surgeries that's been done has been more than double of what we forecasted that the region needs to be done. And because of that, we're actually in the process of hiring our second retina surgeon to start in September.
And is there any particular specialties that this new retina surgeon brings to the team?
Yeah, so I think having a lot of state-of-the-art equipment at RHN, it does attract expertise and talents that we don't expect to attract in the Waterloo region traditionally. So our next hire retina surgeon, he is actually dual fellowship trained, not just in retina surgery, but also in inherited retinal diseases. So a lot of these type of PhD type of expertise, they are usually attracted to ivory towers or academic centers, but we're fortunate enough to have him start in September. So a lot of patients who, for instance, have diseases like retinitis pigmentosa, they wouldn't have to travel to Toronto to get the care they need. They can actually get the care locally here close to home.
So just the legacy of philanthropy is helping bring new treatments, new options for people in the community. That's tremendous. And it is important, of course, if someone has a retina detachment, time is sight. In that experience, and I understand 1 in 10,000 in the population are impacted by retina disease, and what is the impact because we now have this service here locally?
Yeah, I think both for time and efficiency and also distance to travel for patients to seek care. So as you've mentioned, Doug, the retinal detachment can be quite vision threatening in terms of both the acute pathology that patients suddenly cannot see well, and also the damage that can happen very quickly, causing long-term vision damage. So a lot of these cases in the past, they would have to travel to London, they would have to travel to Toronto to get retina surgery. And not just for the surgery itself, but for the post-op care, they will have to go back to the surgeon out of town. And it puts a lot of burden on the families that are involved in the driving and the commute and support. So having these kind of surgeries being able to be done close to home is a huge help for the patients, not just locally, but also in the surrounding smaller regions.
So where do you see the program heading? What's some of the future needs that the donors and the community could play a role in?
Yeah, so as I mentioned earlier, we will be starting to have our second retina surgeon in the fall. And currently, we only have one retina surgery capable microscope at RHN. On the same token, the one retina surgery machine. So we are in need of a second microscope and a second retina surgery machine if it can be available. That if the existing one damage itself or have any issue, we wouldn't have to halt the entire program. That will have a backup. And at the same time, if both surgeons are needed, we can have 2 eye rooms running with 2 rooms running retina surgery. And then beyond that, I think we, with more demand for cataract surgery and an aging population, have been doing more and more cataract surgeries for not just locally, but covering the smaller community around us. So the life expectancy for the cataract surgery machines are also coming to an end. So we're also in need of new equipment on that front.
Tremendous. And do you see we talked a little bit about the growing and aging population. Do you see need for the service in the future? Will our volumes continue to increase?
Definitely, yeah. So I've mentioned in the beginning of the interview that we do have multiple subspecialties that are covered locally. And currently we are covering almost every single subspecialty except neuro-ophthalmology and uveitis, which is inflammation of the eye. And we also will be in need of another glaucoma surgeon and pediatric ophthalmologist. So I think looking ahead, our service hope to grow in terms of subspecialty coverage, so then we can support the growing population and aging population locally, and patients won't have to travel afar for seeking care.
What's ahead around the new hospital in ophthalmology?
Yeah, we're in discussion with the leadership team in terms of planning in advance what kind of surgical resources can be available at the new hospital. Now, that's still quite so many years down the road, but we do hope that if we are planning to grow our program in terms of subspecialty coverage, that we have enough surgical resources to allow new surgeons to be brought on board.
Is there any messages that you would like to send to our donors who are watching our Inside WRHN today?
Yeah, so to all the donors that's been supporting our program on behalf of our division and our patients locally, I give my sincere thanks. Without your support, a lot of the specialty coverage that we do perform daily, it wouldn't have been possible. So we do hope to continue to collaborate with the foundation, and we do seek to continue to inform the public of the demands and the eye diseases that can be both acute or chronic and have huge impact to the patients in the community. And we hope to continue to have support from our donors and the foundation.
Great. And any parting thoughts that you'd like to share?
To everyone out there, definitely keep your eyes on your eyes and make sure you get your eyes screened by optometrists or ophthalmologists regularly because with the better technologies that we have nowadays, a lot of diseases can be caught early. And the demand for eye care is bigger than ever. So keep your eyes open.
There we go. Thank you very much, Dr. Chan, for joining us and sharing the amazing work that's being done at RHN Ophthalmology in our regional eye program. So thank you as well for joining us for another edition of Inside WRHN. Please, you can visit WRHNF.ca, that's renf.ca, our website, to learn more about how you can help make a difference so people can see much more clearly. Thank you.